An alarming confluence of outbreaks across the globe is raising fears of a future pandemic, potentially like COVID-19. Hantavirus, Ebola, measles, among other infectious diseases, are making headlines in the U.S. and raising questions over preparedness. A deadly outbreak of the hantavirus started on an international cruise ship. We've been talking about this in the news a lot. And one person in Colorado even died from the virus, although it was not associated with that. Denver Health's Dr. Lindsey Fish, she's here with us now to talk more about this. Now, we've been talking a lot about the hantavirus, but I don't think a lot of us actually know what it is. So what is it? And is it something new? Has it been around for a while? What is it?
Yeah, so hantavirus is a group of viruses that are transmitted actually by rodents. So think mice and rats when we think about it. It is not new. We have had hantavirus in the United States for decades and in Colorado for decades. We're just hearing a lot about it. And the way you get it, it's transmitted actually through particles in the air when parts of sort of droppings, urine, saliva, and nesting materials get aerosolized and we inhale it. So it's super rare, but this is a great time to talk about prevention for us here in Colorado.
Okay, so talking about prevention, you don't know those particles are in the air. So what do we need to know about the virus and the risks, and then what do we do?
Yeah, so as I mentioned, we do have it here in Colorado. It is low risk and you should not worry about it, but it is something we should be aware of. So in Colorado, we have the sin nombre virus strain that's carried primarily by deer mice here in Colorado. That is different from the cruise ship strain, which is the Andes strain. At this point in time here in Colorado, we aren't worried at all about the Andes strain. We worry much more about the sin nombre strain.
Okay, so what are the symptoms? I think everyone, hantavirus does not sound great. What are the symptoms? What are we looking for?
So the things you want to think about actually are flu-like symptoms, which makes it hard.
Yes.
Think fevers, chills, headache, body aches, nausea, vomiting, diarrhea. People get really sick and end up in the hospital because of respiratory stuff. So again, think cough, shortness of breath, and chest tightness. What makes this tricky is the exposure to the rodent can happen 1 to 8 weeks before you start to get sick. So you've got to keep in mind, have I been around rodents or cleaning things out in the last 2 months? If that is the case and you start to have these symptoms, that's when you need to call your doctor.
Okay, like cleaning out the old garage that maybe no one's been in a long time or something like that would be a good memory to remember. Okay.
Absolutely.
Okay, this does not sound pleasant. Okay, so how can we protect? It's one of those things where it's like, how do you know until you don't know? So how do we protect ourselves and our families?
So one, you want to stay away from rodents. I don't think many of us are spending time hanging out with mice or rats, but avoid that. But really, you touched on it. It's the cleaning that gets us in trouble, especially this time of the year. And what you want to do is never vacuum or sweep up the droppings of mice, for example, when you find them. And we want to think about that when we're cleaning out, as you mentioned, our cabins, our garages, our sheds, especially after the season that we've just had. We have things closed up for the winter and we go to clean. So when we want to clean those out, we want to open up the space for 30 minutes before we go in there. We want to wear a mask and gloves. We want to spray everything actually with disinfectant or bleach and then just pick it up with paper towels so we're not aerosolizing everything.
Okay.
And then we want to prevent it. So as much as possible, seal up those edges so the mice can't get in, store food well, keep clutter up so that we don't get mice in those spaces.
Okay, thank you so much. We have talked about this a lot in the newsroom, so thank you for clarifying so many things for us. Dr. Fish, we'll see you back here next week.